Hello, and welcome to the WHN Broadcast. I'm your host, Karen Ruby. Today, we're starting a new spotlight series highlighting COVID safe businesses. And today, we have Dr. Wayne Suway. Do you mind introducing your business for us and then describing the COVID mitigation measures that you have put in place?
I certainly can. I am a general dentist and I specialize in implant, cosmetic, and restorative dentistry. I am also a diplomat in the American Board of Dental Sleep Medicine, treating patients who suffer from obstructive sleep apnea and cannot, or some patient who cannot tolerate the CPAP machine. Infection control has always been a top priority of mine in the office. And when COVID hit in March of 2020, I closed my practice for about 2.5 months so that I could research and find ways that I could open the office and keep my staff safe and keep all my patients safe at the same time. And most of the viruses we're seeing, whether it's a common cold, flu virus, SARS, COVID, they're all respiratory diseases. And in the dental office, what's going on? Everybody's respiring, essentially. Uh, so you have to have your mouth open to do things. There's drills going, so the air is filled with those type of germs. Now, so what I came up with in mitigation was first I put in 4-inch HEPA filters in the HVAC units. I have two units, one for the front area where my office staff works and patients sit, and 4-inch HEPA filters that are SEER 13, which is takes out mostly everything. The fan on the AC units, HVAC units, goes 24/7. So it's always circulating there. In all the rooms, we've placed air purifiers, and those air purifiers have HEPA filters in them and UV lights, and they circulate the air or scrub the air, as you want to say, 6 times an hour. And they're also in operatories. They're in the waiting room, the reception area, all the office space has those air purifiers. Now, when you get into the actual dental work, we've put in something called an aerosol extractor, and it stays about a foot from your mouth opening, and it sucks all the vapor down through a super HEPA filter. And right besides that HEPA filter where it exits is also the air purifiers, so that everything is air is always being cleaned in the rooms. Now, I was fortunate; I never had an open access office, so all my rooms are closed, other than a door. So there's walls between patients. And I guess the last thing we do, we take temperatures on everybody still to this day when they come in. Every staff member is wearing a KN95 mask. I'm wearing an N95 mask. We require patients to come in with masks on. Uh, Now, as you well know, that they're not using the pandemic protocols anymore, so we give patients masks if they forget them in their car.
Nice. That's a lot of precautions. It feels like a lot of redundancy in there.
Well, to be honest with you, the interesting thing is, as part of this interview, uh, I haven't been sick. I have not gotten sick from a patient in three plus years, and I haven't had a patient get sick from another patient in 3.5 years.
Knock on wood.
Yeah,
That's great.
um, I'm very proud of those statistics, and I'm continuing doing that.
Yeah.
And also we also wear eye protection also, so we're protecting our eyes, shields, stuff like that.
Excellent. And why is it that you feel it's important to continue taking these COVID precautions?
It, it's something I feel is important to continue to do, for my patients, because my patients are my family. So I want them to be safe, and they want their family to be safe. We've initiated these protocols, and and the reason to continue them is you don't know if you have a patient who's immunocompromised when they come into your office, and 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 say I have a patient that's not immunocompromised, and he gets sick, and he has a parent that's immunocompromised. It's 6 degrees of separation, essentially.
Yeah, that's great. Um, has your strategy changed or adapted since 2020? And if so, how?
It really, it, it really hasn't changed. Like I said, for 2.5 months, we researched everything. And this was the best protocols to come up with to protect patients. So it hasn't really changed. I started it when I opened the office back up after the 2.5 month shutdown, and I just continue it.
That sounds great. And from a business standpoint, what has your experience been with continuing to take COVID precautions?
I would say 50% of the people coming in are incredibly appreciative of the things I'm doing for them. There's an added expense to doing all that, obviously, but at the same time, they're appreciative. The other 50% don't want to wear masks, don't really care. But that's up to them. When they come in, I explain to them that I have immunocompromised patients, and they appreciate this. So that while you're here, wear a mask. I'm going to continue doing all my things. Unfortunately, the patients can't see my face anymore. That's it. They're used to seeing pre COVID. They saw my face. Now they don't see my face anymore.
It's the one big drawback.
It's the one big drawback. But you know, patients appreciate it. The overwhelming patients really do appreciate it. I just think it's important. It's important in the dental office to maintain that. It's important to me. It's important to my staff. It's important to my patients, and that's the bottom line.
Yeah. Thank you so much for joining us today, Dr. Suway.
It has been my pleasure to give you that information and be part of this network.
Amazing. We really appreciate you being with us here today and look forward to talking again soon. And if anyone is interested in finding out more about Dr. Suway's practice, the information is right here on the screen. He's in Atlanta. And for more information on WHN, you can go to our website, whn.global, and there you can sign up to join us. Thank you.